Hi everybody, I'm Chip Paul and I'm president of GnuPharma, and I'm here today to talk to you a little bit about why we think we're in a crisis of nutrition in our country right now. And I'm going to take you on a little bit of a journey, so be a little bit patient with me. But I want to talk to you about something that we all have called an endocannabinoid system. In an endocannabinoid system, for some reason, everybody always jumps to the cannabis place, but the endocannabinoid system really has nothing, absolutely nothing to do with cannabis. It has to do with an internal system that we all have. The ECS, or what we call the endocannabinoid system, the ECS, is very, very old. And what do I mean by that? I mean that we developed an ECS before we developed a brain, believe it or not. We developed it before we developed a central nervous system. So before we developed a spine or a brain or a central nervous system, we developed an endocannabinoid system and something called a C-squirt. Very interesting that, right? And we've dragged that all the way up the evolutionary ladder. But it's a very, very old system, and that's the point. It's also very important. So as you look at published research on the ECS, it's very easy to see down any really human silo how important the ECS is. But I think all researchers would agree that in their silo, it's the master regulator or system that's responsible for kind of keeping things going, keeping things balanced, and keeping things interacting properly. Our company, on the other hand, sort of goes the extra step and says we believe it is your everything, your master regulation system. So, why don't PhDs, MDs, and researchers all know about this very important system? Why is it people like us who are out educating about this system instead of universities? Well, I'll tell you a quick story. I recently got asked to speak and teach a graduate class at a major university. I got to meet with the director of curriculum after that class, and I asked him that question specifically. Why isn't the endocannabinoid system taught in major universities or medical schools? And he just gave me a very simple and direct answer. He said, no time. There is no time to teach about this very important system yet in the curriculum of most major universities. So, but hopefully soon there will be, as more education is known about this system. So, and again, one other thing about the system, it's heavily resource driven. So, the system is pretty much your everything. It's pretty much responsible for completely regulating you, and it's a resource-driven system. And guess what the resources are? Food. Very simple food. So that is what drives this system. Now, here's why we think that we're in such a crisis. Is the food that we have to provide to this system has to be in the form of plant-based flavonoids. Plant-based flavonoids are just the things that give plants their properties, their smell, their taste, things like that. They're stored in plants in little fat sacs, right? So as soon as we cook food too long, we rupture these sacs and we lose a lot of the magic or good in our food. Further, all of these herbs and plant-based things, that are so important for our diet, we could get them from the things that we eat, right? So if our beef was properly fed things, or our chicken was properly fed things, then we would by virtue be getting these nutrients, ECS nutrients, through our food chain. But regrettably, that doesn't happen anymore either. So what happens if you don't get proper ECS resources? Well, your body becomes dysregulated. You don't have the gas to run you, and that's a bad thing, right? So you begin to break down. And how do you break down? Issues of regulation. And what are those? Autoimmunes, inflammation issues, diabetes, allergies, pain management, issues of the gut, cancers. All of these things are related to regulation, and in our mind, they come from one thing: we're all malnourished. So how do you fix that? Well, you can fix that by eating more raw plant-based flavonoids, or you can obviously supplement with our products. But we will be doing a lot more education about this in the near future because we think this is critical and very critical to our health. Thank you very much.